Hello everyone, so let's talk about bone metastasis, and we have an image in which there are three different players. So this player, he's looking very furious and he's a pro state champion and he has small lungs, so lungs should have been here, but for the sake of the visual mnemonic I've drawn it here, and he looks very angry. So he's a pro state champion, that's why it's prostate cancer. He has small lungs, that's why it is small cell lung cancer, and he looks very angry, that's why hot, so it's Hodgkin's lymphoma. Okay, and can you see behind there is a blast happening? So all of these cancers are going to produce osteoblastic lesions when they are going to be metastasizing to different places. Now this is a mixed in the sense it can be osteolytic as well as osteoblastic. So this is going to be a female. You can see that it is because of she's a female, so it's breast cancer, and she's holding a stomach, that's why it's gastrointestinal cancer. Now in this part of the image we have a boy or a runner. So he's there and there are multiple moles here. So multiple moles, that's why it's multiple myeloma, and he's a runner. So renal cell carcinoma. He has a black patch here, that's why it's melanoma, and he's disagreeing to whatever he's saying. So he's disagreeing. So he's saying that he's not hot and he's not small. So non-Hodgkin's lymphoma and non-small cell lung cancer. So why do we need to know this? So while you're solving in exams, they are going to give you an elderly patient with back pain, and you might get really confused when you are going to discuss or when you have options like prostate cancer, multiple myeloma, or Paget's disease. So one simple way to look at this is look at the metastatic region. So if you have a prostate cancer, they are going to tell you that it's the patient is having focal tenderness, and you can see sclerotic lesions. So we know that this is going to be sclerotic means blastic lesions, right? So if you see that there is a sclerotic lesion, think about prostate cancer. Okay, if you think about multiple myeloma, you have to think about lytic. So we know that it's multiple myeloma is having lytic lesions, right? So if a patient is having multiple myeloma, he will have lytic lesions, and if a patient is having Paget's disease, he will have mixed. So he'll have both osteolytic as well as osteoblastic.